If you pooled individual level data from 112 studies in 34 countries and 8 geographic regions for 1.5 million people over 57 years, and identified the risk factors for cardiovascular disease and all-cause mortality, what would you find? The Global Cardiovascular Risk Consortium did just that and compiled individual level data on 1.5 million people from 1963 to 2000 and published their findings in August 2023 in the New England Journal of Medicine. So what did they find? They found a higher risk of cardiovascular disease in women than men, 57.6%, I believe, 57.2% versus 52.6%. And the deaths in that study of men and women, respectively, were 22% in women and 19.1% in men of those 1.5 million individual data patients. From all that data they pooled together, they identified 5 risk factors that you can modify that represent the most common reasons for cardiovascular disease and all-cause mortality. Here's the study. Here's the link to the study. And then let's look at how many authors are involved. Okay, those are all the authors from all around the world. This is a global consortium. This is a table from the study, Associations of Risk Factors with Cardiovascular Diseases and Death from Any Cause. And then we need to explain hazard ratios, because that's what they've graphed out. So a hazard ratio of 1.0 is no association, with a higher number being a higher association, a lower number being a lower association, or hazard risk factor. So let's look at the 5. The 5 risk factors that are modifiable that they looked at was body mass index, 20 millimeters of mercury increase in systolic blood pressure, non-HDL cholesterol, so think bad cholesterol, LDL, not HDL, the good one, current smoking, and diabetes. So let's look at this closer. This is for cardiovascular disease risk. So body mass index, weight, really doesn't show any association at all. 50, 60, 70, 80 years. So the horizontal axis is age, the vertical axis is hazard ratio. 20 millimeter of mercury increase in systolic blood pressure is there. Non-HDL cholesterol, so LDL, is there. Current smoking, and diabetes. So you're looking at really no risk with increased BMI. In fact, they had a higher risk with a BMI of less than 20, which they found in sub-Saharan Africa. And then a lower risk if the BMI was over 30. 20 millimeters of mercury increase in systolic blood pressure in a younger person, yes. So 1.6 will say 60% higher risk factor. Non-HDL cholesterol basically goes away the older you get, so it gets lower the older you get, which kind of goes along with a higher cholesterol keeping you alive longer, which I've told you about in studies in the Netherlands, in Europe. Current smoking is a huge one. So 2.7 would be, so 2 would be 100% greater risk, so 170% greater risk with current smoking. That goes down a little bit as you get older. And then the biggie is diabetes type 2. So right before the age of 50, the risk is 450% higher. This is graphed based on different regions and different countries. And this is for cardiovascular disease. This one is death from any cause. So BMI, really not a factor. Systolic blood pressure increase as a younger person, about 50% higher risk of death. Non-HDL, so LDL, no real association. And again, if you read the entire study, the lower the LDL, the worse the outcome. Higher the LDL, a better outcome. Current smoking hits you at 170% higher around the age of 65. But then look at all-cause mortality in type 2 diabetes. Kind of fits that same pattern on cardiovascular disease risk. This study was evaluated by Zoe Horcombe, I hope I said that, Horcombe, who has a PhD in public health and nutrition. She's in Wales. She also has a degree from Cambridge in economics and math, and she does analytical evaluation of scientific research. And her focus is obesity and nutrition guidelines in public health, which she is contrarian about quite a bit. So her executive summary from this paper are the following. So I'm just going to read them to you. The two outcomes of the study were cardiovascular disease and death from any cause. The 5 risk factors were chosen because they were modifiable. So body mass index, systolic blood pressure, non-high density lipoprotein, so LDL, cholesterol, smoking, and diabetes. Data from 1.5 million people, 112 population studies, 34 countries, 8 regions. 57 and 53% of incidence of cardiovascular disease among women and men, respectively. 22%, 19% of deaths from any cause among women and men, respectively. That may be attributable to those 5 risk factors. So that's what they were looking at. What's your risk from those 5 risk factors of cardiovascular events and cardiovascular and death from any cause? So the inference was that these percentages of cardiovascular disease and deaths could be avoided if the risk factors were modified. The study found other results that were not highlighted, but that she pointed out. In order to get to her newsletter, you're behind a paywall, so I pay for that so I can give you this information. Low body mass index was substantially worse than high body mass index, so 20 versus 30. Cholesterol was either irrelevant or higher bad cholesterol had lower death rates. And that's kind of the outcome you want to know. What's your risk of death? The 2 biggest risk factors by far, smoking and diabetes type 2 being the single biggest issue, which is modifiable. Type 1 is not. Type 2 is modifiable. So there you have it. That ranged from studies all the way back to 1963 to 2000. So we'll see what kind of fights I start with that review. But published in the New England Journal of Medicine by a global consortium. So what do you think? Have a great day. Talk to you later. Bye.